everybody, to our second episode of Let's Talk About Aging. And today we are talking about hospice care. What is hospice? What do we not know? And what are the myths surrounding hospice care? So today we're very thankful to have Avalon Hospice with us. We have Laura and Malik with us who work in this every day. You know, we wanted to have the experts come in and really educate us on what we don't know. So thank you for being here, first of all.
Yeah, thank you for having us.
Thanks for having us.
Of course. So to be an expert, we need to know your why, right? That's really important to know why you do what you do. So if you don't mind, Laura, first, if you can tell us why you work in hospice and how you got into it, and then we'll go to Malik.
I was actually working at a long-term care facility, and I was a nurse there, and I was working really late one night, and I had a patient who was on hospice, and this patient was struggling just a little bit, and so we called the hospice nurse to come in, and the way that hospice nurse cared, not only for that patient, but for the patient's loved ones who were also there, was so just heart-filling and just so, she was so compassionate, and I just knew that's what I wanted to do.
Wonderful.
I wanted to be a part of caring for not only these patients that are faced with this situation, but also for their loved ones. So
that's really great.
Yeah.
I appreciate you sharing that story. I think that to work in hospice, you need to have a connection somewhere, you know, where you are able to kind of step back to the why on a bad day, right? You know?
Right. Yes.
So Malik, how did you join hospice?
I was in sales prior, but I realized this sales is actually serving folks in their time of needs, patients and family, and so I feel like I'm doing the most that I can to help someone at a time where they're going through really a lot, and not knowing what to do, but we're able to shed some light on how we could help.
Good. And you must have a servant heart to work in this field.
I
you
try.
have to.
I try, and this makes it so. I mean, it's just hard for me to complain about anything doing this on a daily basis because I should be I should be thankful for everything I've got now.
Wonderful. Well, thank you for that, guys. Let's kind of jump in. There's a blanket question, right, that you start with any topic. And what is hospice, Laura? What is it?
So hospice is the care of someone who has a life-limiting illness. That can include many things, and we'll get into that later on.
Okay.
But it is just caring for this person as a whole team, but not just caring. You don't want to focus on caring for their disease process and the healing portion of that. You want to care for the person and provide them with symptom management, and that in essence provides them with a much better quality of life. They can spend their final times with their loved ones and having conversations that need to be had, and it's just really providing a service for them that is going to provide them with symptom management and quality of life, and then we also get them connected with resources in the community that can also be of such a benefit to the patient and their families. So.
Great. So who is eligible for hospice? It's not something you just can sign up for, right? So who's eligible?
So anyone that has been diagnosed with a terminal illness or with a life-limiting condition, such as you can have Alzheimer's or dementia, you can have heart disease, respiratory disease, different, all types of cancers if you're no longer wanting to pursue the treatment anymore, liver, kidney disease, so the list goes on, HIV or AIDS, and so the list just goes on and on, but anything for a life-limiting condition.
Gotcha. So Malik, tell us a little bit about where is this hospice care provided?
So hospice is provided wherever a patient deems home.
Okay.
It could be in a facility, long-term care, assisted living. It could be in their home, because around 70% of hospices is provided in the patient's home. And also if it's necessary, it could be provided in the hospital.
Okay.
And so it's wherever a patient is more or less comfortable, or where they feel the most comfort, I would say, so they call home.
Okay.
Will come to them.
Well, I think that's nice to know for a lot of our viewers, is that it's not that in the hospital only, or that you have to go somewhere that's not home, that you can be in your home environment, whatever that is. That's a wonderful thing, not only for the patient, but for the family too, I would think, right?
Absolutely.
So okay, we know where it's provided, but who provides that care?
So now, the hospice group are made up of registered nurse, hospice aide, our medical director, a social worker, chaplain slash grief counselor, and trained volunteers.
Okay.
And so they're providing that care. They have their own specialty to provide that patient and the family in the care in a home setting, so that it gives them a lot more, and lets the family know that patients can predict, or kind of let them know how they want their care to be set up and tailored, and they'll be provided for them.
Okay, gotcha. So that's a lot of people, right? That's a lot of people involved, which is a wonderful thing. And the grief counseling, because grief doesn't come after only.
Yeah.
Grief starts just
early.
with diagnosis sometimes, you know.
Absolutely.
So that's really nice to know that that person is part of the team and from the beginning, you know.
Right.
And a social worker too.
Mhm.
How invaluable, you know. So so that kind of takes us to how expensive is it, right? That's a lot of
Right.
people involved.
Right.
So how do I pay for this, and is it expensive for me or my family?
So hospice is Medicare benefit, and also some private insurances and Medicaid would cover it. But this is covering everyone's coming out, medications and equipment related to the diagnosis, and all this is being provided. And so it's definitely trying to provide all this for care to provide a higher quality of life for the patient for the time that they have.
So it helps with the equipment.
Yes.
That is huge,
Yes.
you know,
Huge deal.
like hospital beds, wheelchairs, things like that are so expensive. If
Right.
you've never been down this road, the equipment can get really expensive to rent or buy. But for that to be a benefit of hospice is huge. So
Absolutely.
that's great to know. And there's not an age, right? It's just through insurance and things like that.
Right.
Right. So kind of talk to us a little bit, Laura, about, you know, who hospice is for. I think it's a myth that we think it's for those who are close to death or have cancer that are close to death. Kind of tell us a little bit more about who it's for.
Okay, so hospice doesn't only just apply to cancer patients, so it applies to anybody with a life-limiting illness. And like actually, most patients do better the earlier in the disease process that they can come onto hospice. So when you can control someone's symptoms earlier on in the disease process, they normally have more comfort and more quality of life throughout their disease process. So it's more beneficial the earlier they can come on.
That's really great for everybody to know. I know we can vouch for that, being in assisted living.
Right.
We want to bring hospice in at a time, you know, where maybe the decline has just began, you know, and of course they'd have to qualify, you
Right.
know, but we want to do it way before we get too far or towards the end, because we want to make sure that they're comfortable, that all the resources are known and are used, and you know,
Right.
we're not just trying to pile everything in at
Right.
the end, you know. So I think that's really important for everybody to know. If you don't, hospice can come in earlier than most of
Right.
the population thinks, honestly.
Right.
You know. So that kind of leads me to a do not resuscitate order. Most of us know that as DNR. Is that something that has to be signed when they come on hospice?
So a lot of patients that are wanting hospice do already have a DNR, but it is not a requirement. A lot of people think that it is, and it is not. So we work with the families, we educate them, and sometimes they may want to eventually sign a DNR, and sometimes they don't. It's a personal preference, and it's a decision that they have to make within themselves and with their families. And so we just honor their wishes, and you do not have to sign one.
I think that's great, because it can be a lot to go on hospice in the first place,
Right.
you know, but then to know that the DNR can come later, the family can have time, the patient can have time to really talk about this before signing it. That's really great to know. That is. So Malik, that kind of takes me to the doctor. So I have a primary care doctor that I love, and he has been with me and my family. He knows us. I wouldn't want to give up my primary care doctor. Do they have to do that and go with your doctor, or how does that work?
So now patients coming on hospice don't have to give up their primary care physician. Their primary care physician works with our team and our medical director in order to create the best possible care plan for them. So that is not needed whatsoever.
That's nice. And I think that would provide a lot of comfort to us because doctors become part of our family,
Yeah.
right?
Right.
Especially when they've been your primary care for so long. And it's more your medical director is an added benefit instead of a replacement, basically.
Right.
Okay, gotcha. So, Laura, I want to kind of shift into how does the family's involvement with care go? Is all the care all on the family, or how does your team come into play with care?
Okay. So we have a lot of families who are hands-on, like they want to provide that care and they want to do that. And then we have families who want to do that and can't. People have jobs and people have lives outside of, just this diagnosis and
Right.
everything that's going on. But we're able to care for patients in their home that live alone. We're able to care for patients who have family members who can't care for them but are living in the home. So what we can do is we can scatter our disciplines from a nurse visit one day, an aide visit a different day, and kind of scatter everyone to where we're in the home more frequently. When we know patients, don't have as much support, we can connect them with community resources, and those are really beneficial in helping the patient to be able to stay at home, even if they don't have the support that they feel like they may need.
Okay, gotcha. And that's nice to know that you can kind of scatter,
Right.
the care. You hear about the sandwich generation a lot now, where you have an aging parent, but you still have children at home, or you have your career, and it's hard, right, to be
Right.
everywhere you need to be when you need to be there. So that's really nice to know that because you have such a large team, you're able to tailor that to the need of the patient and their
Right.
family. I know that is true just from when you all have been in our community. That helping when the family's not able to be here, and really making sure that the patient is getting as much care as possible and spread out. So Malik, I want you to kind of walk us through the beginning. So, hospice agencies, there's a couple out there. What's the differences? Educate us on what to look for, kind of, if I'm a loved one going in, I don't know what I'm doing, how am I going to know what agency is right for my family?
What I would say is that, first of all, the federal regulations for hospice are for us to provide a service which is all similar. But doesn't mean we're the same. And so for one, I would ask families to interview, have someone like myself or Laura come out, talk to them in a setting that they feel comfortable, have some questions, get our number for follow-up questions, and then what I say with hospice, what makes agencies different from others is the response time, customer service, admission, and that right there is what families are looking for, because coming on hospice is not giving up hope.
Right.
Doesn't mean death is coming any sooner. It's just the time that we're in there, it's quality of life for patients to be with family members, for them to love on them, and just to enjoy the time that they have.
Right.
And so that's what I would say for someone who's not used to hospice or even talking about it, is to interview.
Definitely. It's kind of like with assisted livings, you have to see where it feels like home to
Right.
you.
Yeah.
So I would think the same thing when you're interviewing hospice agencies. What connects with your family well,
Right.
and I would also think a team that has a big team, a big amount of team members,
Right.
because this is a 24/7 thing, right?
ma'am.
They might have a need when you're not on Monday through Friday,
Sure.
Right.
so you need to have a large team to cover all the needs.
Mm-hmm.
So in the beginning, we talked about what is hospice, what's it about. But I want to circle back to that now that we're kind of winding down to the end. Revisit that, Malik. What is hospice about? We've learned just from talking with you that it's not about dying, right? So review that for us. What is hospice about?
So hospice is actually about living. If you can manage the pain and symptoms of a patient, then it gives them a lot more time to be there with loved ones not having loved ones worrying about some of the things that we can just handle for them. Giving them time just to not relax, but just to enjoy the moment.
Okay.
And so having a patient coming on early gives them an opportunity to get all the benefits. Also for us to be comfortable with them and them with us. And then also it's just getting to understand that it's not just about the patient, but the family as a whole. We want them to all be able to share in what's happening and be comfortable in the process and be able to rely on us to help them.
Yeah, that's so important because it's the whole family, and that family might involve people like us, right? That live in assisted living. They become part of our family, and I know my staff, when we go through this process, they're grieving, you know, and hospice helps us. So I really appreciate all that you guys do. I do. And I hope that this was beneficial to all of our viewers. For more information, reach out to the Rutherford Assisted Living. We'll get you in contact with Laura and Malik from Avalon, and we'd love to help your families. If this is something that is coming close to you, something that's being brought up to you, don't hesitate to reach out and ask questions. You have a community here, especially in Rutherford County, that is big on education. So just know that there's a lot to learn, and you're not alone in this journey. So thank you for viewing, and thank you all for coming.
Thank you.